kind of highlight a few of the drivers. There's hundreds and hundreds of drivers that affect our business on a day-to-day basis. What we've tried to do here is define, kind of 5 buckets that those drivers would fall into that we can talk through generically. The first bucket we want to look at is what we call the market bucket. It's the expectation the market brings with us. We've seen a lot of changes in the last 2 years since COVID in this space. Employees want to work from home. So we see our employees changing their expectation of the business. They want to work home or work remote. We see our patient experience and what they're expecting changing, and their demands for us to be more real time are much more important. We're also seeing a change in the competitive landscape, right? So there's drivers that competitors are doing business, are changing their business with. One of the big things I've noticed that's happening is that 5 years ago, 10 years ago, your provider was a local provider, was a doctor in the community, had a small office, serviced their patients, very personalized service. They're basically funding their growth from their own pockets and trying to make a living doing that. Today, there's PE firms buying up, private equity firms buying up practices all across the nation. They're creating these super mega companies that you're competing against. And they're investing in technology at a pace that most organizations can't keep up with. So that your very nature of who you compete against is a different environment today. We've all experienced the third driver in a big way in the last 2 years. COVID is one example of a crisis situation that forced us to change, but we're seeing it come from all kinds of areas, not just the pandemic that we were experiencing, but we see it with natural disasters, whether it's floods, tornadoes, and hurricanes. Wildfires are getting more pronounced, more pervasive, lasting longer, historic records that they're achieving. We're seeing political unrest even here in the US. We're seeing economic unrest that's causing challenges. So we have these crises that force us to change and evolve our organization. The fourth area that we look at is the threat landscape. And this is really around security. It's hard to imagine that 10 years ago or before that many healthcare providers were not on electronic medical records. They did not have technology in their offices. Most of the documentation was paper files in a file cabinet. As soon as we started opening up our environments to put all those records online, the risk of that patient information being compromised increased. And today, it's at the highest level it's ever been, and it's only going to get worse from this point on. Then the last area that we got to look at is the regulatory changes that are affecting the way we do business. So Michael, I'd like to start with you as a Chief Information Officer for the community medical centers that you work for. I'm sure that you've experienced a lot of drivers that have impacted your business over the last few years. What do you think the biggest biggest impact that you've experienced?
I would definitely say it's been the crisis component, followed by threats, and then regulatory.
Okay.
Market and competition have not been as great of factors, though they are significant factors, but they have not been as great. As with many federally qualified health centers, community health centers, and other organizations across the landscape, regardless of the business vertical, the crisis of COVID forced a lot of change. It made us change how we deliver care. It made us pivot in terms of where our employees are physically domiciled. It's made us change the technology landscape, of course, with the expansion of remote work. That means that you've extended your network far beyond your normal, or what were your normal physical borders. And so that, of course, opens you up to a larger attack footprint or vector. And so having to deal with those things while you simultaneously transform those portions of your business so that you can continue to deliver care and maintain revenue streams, et cetera, et cetera. But at the same time, you've got another set of challenges that comes with that type of change. So it's been pretty significant. Threats,
Michael,
of course.
I'd like to pull in later to this part of the conversation. One of the things you and I talked about last time we spoke is that we could look at these drivers as a good thing or a bad thing, right? Most people, when they look at change or they look at these drivers impacting our business, they look at it as a threat. They look at it as a something that is harmful to the business. But I think we were saying that if we were shifting our perspective and looking at these drivers as a positive, So Laird, I'd like to kind of just get your thoughts on that kind of shifting perspective, looking for the opportunity versus the kind of threat condition.
Thanks. Yeah, I really like your point here, is that, the crisis, COVID, let's just give it a name, COVID, had a dramatic effect on the healthcare industry. And yet some use that opportunity to really differentiate themselves. So you could lean into a crisis, for example, and use it to create competitive advantage. And I think what's happened with these drivers is a business could look at them two different ways. You could look at these drivers will happen to you, they hit you and you have to respond to them, or what's better is to lean into them, recognize the fact that yes, the market is changing. Or, by the way, this matter of cybersecurity is of something is really concerning, because if as a practice, I lean heavily into responding to the market's expectations or the competitive expectations, if I lean into that too heavily and ignore my cybersecurity, I put myself at tremendous risk. So you have to lean in every one of these at one time. That's a real difficult thing to do I think of ones like you, Michael, as a CIO, that's a real challenge. But if you just sit back and let them happen to you, that creates the biggest problem.
I certainly agree, Laird. It's a very delicate balancing act, no doubt.